Hello, everyone. Hi, everyone. Can you hear me? Okay. So we'll give it another minute and then we'll begin. Okay. So thanks, everyone, for joining, whoever you are, on Instagram and on Facebook. My name is Gil Barzilai, and I'm here to talk to you about winter wellness and how to stay healthy through the season. But I've got to start with my profession, which is Chinese medicine. So I want to give a bit of an overview on Chinese medicine and then um, how we tackle winter diseases, whether it is the common cold or the influenza or even some new strains of COVID. What we're going to talk about is a little bit about Chinese medicine. Then we're going to talk about optimal nutrition for the winter diseases, and how to prevent or treat those diseases using Chinese medicine. Um, I want to start by explaining, for those who are not familiar with Chinese medicine, that TCM, or traditional Chinese medicine, is a bit of a toolbox, which means that we use acupuncture, we use cupping, of course, as well. We use herbal medicine. We definitely look at the nutrition of the patient and to see whether it supports immunity or not. We promote movement using Qigong and Tai Chi. And at times as well, if available, we recommend some body work like Shiatsu, which is Japanese, and Tuina, which is Chinese. Now, If I want to talk a little bit about the background about Chinese medicine, well, first of all, it's based on ancient knowledge that goes back to thousands of years. And it made headlines mainly in the 70s when President Nixon was treated in the hospital with acupuncture before he was going surgery for appendicitis. And the interesting thing about the philosophy of Chinese medicine is that it has the perception that as within is out, meaning what is happening on the outside, like the temperature, like whether it's damp or dry, um, like whether we are in a closed room with Wi-Fi and electricity and lighting and whatever, or we are in nature, it really affects our body. And I think that most of us in today's world completely ignore that. We think that it's normal to have white screens and it's normal to have lamps everywhere, and it's normal to have Wi-Fi extenders everywhere, and to even have Wi-Fi on our mobile turned on all the time. But it really affects our body, even if we don't see it. Um, Essentially, the human body is seen as a system of organs and channels, which are called meridians in Chinese medicine, where the energy is flowing. And the way you get energy into your body is based on several things. First of all, on breathing. Many of us forget to breathe, so we do our heart a favor and our lungs by inhaling for a bit, but only up to here, and then we exhale immediately. Nutrition. Many of us eat ultra processed foods which do not provide a lot of nutrients and a lot of energy. The genetics, not much we can do about it. That's called in Chinese medicine the Jing. And of course, sleep, which most of us take for granted, that it's okay if we don't sleep well. Now, it's okay if we don't sleep 1 or 2 nights, but if we undergo pressure all the time and we don't sleep for days and days, that becomes an issue because it increases sugar levels, it increases blood pressure, it increases the hunger hormone for those who want to lose weight, it increases cholesterol. There are many, many issues with not sleeping for days and days. Now, when there's enough qi and it flows around the body, meaning we are in movement, we don't have any fixations or stagnations that cause the blood and the qi not to flow, then we should be in good health. And you can see here that the way Chinese medicine looks at things is really what is on the outside affects our inside. And you know it yourself when you're on holiday, when you're on the beach, or when you're on a snowy mountain, if that's what you like doing. I assume that you all see that you feel the energy coming into your body, and the same with the seasons that you can see here on the left. Each season has a climate attached to it. So, for example, the summer is usually very damp and hot, of course. The autumn is very dry usually, and some people have dry lips, dry skin, dry eyes, etc. The winter is very cold and can be damp as well. And spring is something that takes it all out of our house and into the wild and into the growth of plants and flowers and blossoming and things like that. Something that allows for growth to happen. Now, when you look at the different approaches to healing, the West versus the East, you can see that in allopathic medicine, the target is reverse outcome, which means that if you have fever, we need to eliminate it. If you have runny nose, we need to dry it. If you have cough, we need to stop it. That's okay in certain situations. For example, if I had to give the lecture now and I have a runny nose, that would be a problem. But it doesn't mean that it makes, the normal way is to allow the body to get rid of what has caused it in a natural way, even if it takes a few hours or days. That's the old way of doing things. Allopathic medicine or Western medicine is great in emergency. In many, many cases, it will be over-the-counter symptomatic medicine. has wonderful advanced surgery, wonderful advanced technology for diagnostics. It's relatively new, and the experience is based on a lot of clinical trials, a huge group studies, because it's supported by governments and um, by pharmaceutical companies. When you look at Chinese medicine, it works with the body to get rid of the disease, and that takes some time for the body to return to balance. It's preventive usually. So the whole idea is to understand the root of the problem and why, for example, someone is suffering from a cold again and again and again. Um, it really takes into consideration body and mind, really understanding, for example, that if someone has, let's say, lower back pain, and it prevents them from going to work, then obviously they're going to get very stressed about it, frustrated, maybe angry, and that will exacerbate the pain. So the mind has effect on the body, and the body, of course, has effect on the mind, and we need to consider both of them together. It's usually non-interventional in the sense that we at best put needles, but we try not to manipulate too much the body. It has sensory diagnostic, which means we listen to the patient, we observe, we feel. It's traditional, and of course, it's personal, meaning not. I'm not saying every patient gets a completely different treatment, but generally speaking, there is a different treatments for different people. If we talk about the diagnosis of Chinese medicine, we look a lot on the tongues of the patients. You can take the tongue out, and we look at the colors of them, and we look at the colors, the smell, the thickness, everything. We do a very clear and detailed interrogation of the patient. We take the pulse of the patient, so the pulse that we take here, and the pulses are very interesting, because it's not only the number that we try to look at, but also the depth and the quality of the pulse. We look at the patient's face. So if we see very pale color, very red, very oily, very dry in certain parts of the face, reflect on certain organs in the body. And we also look at the personality of the person as much as we can. For example, if a patient is waiting in the waiting room, and they're complaining that the treatment hasn't started on time, they're a very certain type of very accurate and inflexible patients, which may reflect on the types of diseases that they may have. If the patient is very loud and talks, in their mobile, in the waiting room, very loud and very aggressive with all their hands and everything, that also tells us about the type of personality, etc., etc. If a person is very shy and not looking at you, for example, looking down, hardly answering the questions, talking very, very quietly and stuff like that, that also tells us about the personality and the type of diseases that they may suffer from in the future. Now, let's talk a little bit about the diet that the winter loves, because now in today's world, with all the supermarkets opening, some of them 24/7, and the ability to transfer or to import foods from all over the world, for example, getting pineapple in countries where there's no chance that pineapple would grow, getting grapes in the winter, for example, which is not something that we should be eating, because grape is a very cooling fruit, and that's why it is very popular in the summer, because it's supposed to cool us in the heat and the dampness of the summer. So we all got confused into what we should be eating. So this is what the winter loves. First of all, it likes warm and cooked and easy to digest food, because we're supposed to be a bit of bears. We're supposed to be sitting at home, doing less sports, being less active, and eating easy to digest food. So less raw, less cold, less smoothies. All these smoothies, keep them for the summer if you like them. More soups, more stews, more porridge. The second thing is warming and astringent spices. We're talking about ginger, cinnamon, cardamom, black pepper, cloves, nutmeg, cumin, turmeric, fenugreek, rosemary, and the entire family. They're all good, they're all warming, they're all something that we want to include in our dishes and in herbal teas, so that we can warm our body from the inside. The third one is to have an infusion for daily use, meaning that you need to drink warm drinks. that improve digestions. For example, the licorice root is wonderful, cinnamon is wonderful, ginger is wonderful, again, fenugreek, sage, turmeric, all of them are excellent for daily use. Less drinking, for example, of green tea. Green tea is cooling and drying, something we should be drinking in the summer. Use more neutral or warm or hot ingredients in the cooking, for example, onions and garlic and radishes and kohlrabi, meat, buckwheat, pickles, miso, fennel, cabbage, mustard greens, pumpkins, squash, carrots, sweet potatoes, mushrooms and berries, and all the legumes. Again, these are easy to digest when they're cooked, and they give you a very hearty meal that provides you with all the minerals and vitamins, but also with the fibers that are very good for nurturing our digestive system. And the last thing is to have small portions on small plates. So we now are used to IKEA plates, which are over the last 20 years have grown by 20% and are bigger. And we need to move back to small plates and have small portions. And if you want another portion of a soup, then be my guest and take it. But it's better than to start with a very big plate, and then you end up with eating too much. And with the winter, you just feel like the only thing you want to do is just sleep. So that's what the diet that is recommended for the winter. And now let's move into how not to suffer from the winter diseases. And I want to go into the understanding of why there are some people who get sick from anyone coughing next to you in the bus, in the train, in the kindergarten, in school. They just get sick all the time. And there are several reasons for that, because the immune system is not strong enough, and there are reasons why the immune system can be compromised. So the first reason is sleep. If we don't sleep enough hours, we're supposed to sleep at least 6 hours, or probably 6 to 7 hours at least. The number of natural killer cells, which are the natural killer cells in our immune system that kill viruses and bacteria, is lower. Same with the amount of T cells. And at the same time, the pro-inflammatory proteins in our body increase, which means that if we don't sleep well over time, we get less of the attacking immune cells working and more inflammation happening, and that can compromise our immune system. The second thing to talk about is that we are stressed. We are stressed all the time. We read the news. We have all these apps. We get annoying things on TikTok or Instagram or whatever. We get emails from our bosses and colleagues that piss us off when we want to relax and have dinner with our family or partners. What happens when we're stressed all the time is that there is an increase in the secretion of cortisol, which is a hormone, and cortisol is a stress hormone, and the cortisol reduces the functionality of the immune system, which means that our immune system again is compromised just because we have too much cortisol running around our blood. The other thing that can affect our immune system is whether if we're too stagnant, meaning if we're sitting in front of our laptop or in front of the TV or whatever our work is all day without moving. What happens is that if we don't move, the blood and the lymph system is stagnant and it's not moving. And so if you have any anything attacking you, even any injury that happens, nothing is coming into the site of injury because of the way we are living in today's world. The fourth point that may compromise and make us more susceptible for continuous illnesses is our diet. You have to remember that our digestive system is responsible for about 70 to 80% of the production of the immune system cells. So they're produced mainly in the gut or in the digestive system. And therefore, if you're eating ultra-processed foods, if you're eating crackers, and if you eat biscuits and Nutella and ice creams and God knows what else, you're not providing nutrients to the digestive system, and your immune system will be compromised. There'll be less production of immune cells. The last thing is that whether you have some deficiency in vitamins or in minerals, and so the the way to improve your health would be to take vitamins, certain vitamins, certain mushrooms that we'll be talking about in a minute, and maybe adaptogenic herbs, which we'll be talking about later as well. So first, I want to talk about supplements that are worth having at home, at any home. Vitamin C is one of the ones that is very good. I will say that vitamin C is not very useful when you take it before. It's not a prophylactic vitamin, meaning it won't prevent you from getting a disease. Once you feel that you're getting something, you're catching something, taking vitamin C is very useful, but don't take pills bigger than 250 milligrams. I take when I need it, even up to 1 gram, but I break it down to 4 pills of 250 milligrams, because if you take 1 gram, the digestive system doesn't know how to deal with it, and you will essentially urinate it out of your system. So it's better to take 4 pills of 250 over the day in order to supply your body all the time with additional vitamin C. Vitamin T is very good. Vitamin D on normal doses, especially in the winter when there's no sun, would be 1,000 international units. But when you're sick, you could go up to 2,000, 4,000, even up to 4,000 international units. And taking it together with vitamin A and K is very useful. Zinc is essential when you have winter viruses. You can take also medicinal mushrooms. For example, I put photos here for reishi here, cordyceps, and turkey tail. Reishi is an adaptogenic and antiviral, also very good with strengthening the immune system. Cordyceps is a very important mushroom when you want to deal with viruses of the chest and of the respiratory system, and that's why I recommend it. We also give it a lot for patients who suffer from bronchitis or post-COVID, for example. And turkey tail or Coriolus or Trametes is the 3 names of this, is wonderful for flu. We'll talk about it in a minute. Isatis is the Isatis root is a Chinese formula called Banlangen. You can find it also in Europe, in the US. Excellent to take when you begin to have a cold. Oregano oil is wonderful when you have sore throat, kills everything. It's nature's best antibiotic. Elderberry or Sambucus is a wonderful extract that flower that strengthen the immune system. Same with Echinacea as well, which all of them you can find all over the world, and probiotics as well. Why? Because probiotics are essential for us in order to strengthen the immune system, the digestive system, where the immune system is being manufactured. So if your digestive system is not getting good food, and or you had a lot of antibiotics, for example, or other things that have compromised the digestive system, taking probiotics is essential as well. So keep all of these in your kitchen. You may need them during winter time. Now let's talk about the common cold versus the flu. They are a little bit different. So in Chinese medicine, we'd call the common cold the wind cold. And the main expression of it is runny nose, a lot of mucus coming out. You can essentially finish a whole box of Kleenex tissues. You have tingling throat, but not necessarily sore throat. Fever without sweating. It would be very low fever. I'm talking about 37.2, 37.4, 5 maximum. Clear aversion to cold. You won't like the cold. You may have cough. You may have some sort of tiredness or fatigue. You may have some tightness or painful muscles, especially in the neck and the shoulders area. And the recovery is likely to be quite quick. When you talk about wind heat, which is the flu, that's completely different story. So we're talking about significant or high fever, usually over 38, 38, 30, 38.5, could be 39 as well. You may have severe pain. I'm talking about the body and the head feeling like you just want to lie in bed because you can't even, you may even, when you stand, you may have your muscles or your leg shaking. You will have probably significant sore throat. significant weakness and fatigue, loss of appetite. The last thing that you may want to eat is food. You may want to have is food. You may have runny nose or cough, but not necessarily. Cough, sometimes people have after the flu because a bacterial infection happened after that, or a viral influenza. And then, sorry, not influenza. And then you end up with cough. And the recovery can be slow. It can take a week at least, if not 2 weeks. And then after that, you may feel a little bit fatigue and others. The treatment is going to be a little bit different. So let's talk about treating the common cold first. First of all, the first thing we want to do is encourage sweating and fever out, because it's very low grade fever and it's very easy to take it out. And the way to take it out with herbal infusions, for example, having a tea with fresh ginger, cinnamon, green onion. You use the white part of the green onion. It won't taste great, but it will take the virus out. Black pepper, honey, all of these are wonderful things. Brandy, whiskey, arak, honey, all of this could be good. Again, I'm not trying to suggest that you should get drunk, but all of them get you into sweating mode. And when you sweat, or vodka as well, by the way, when you get to sweat, you sweat out the disease. Acupuncture could be wonderful if you catch it on time. Cupping could be wonderful if you catch it on time. And then there are 2 Chinese herbal formulas, which I checked. You can get all over Europe and the US as well. Erchen Tang and Gan Mao Ling are 2 formulas that you can get abroad and use them. They're very good as well. For sore throat, I would use oregano oil. Definitely, you just take the oregano oil and stick the pipette directly into your throat. You need to drink plenty of fluids to flush out the virus. You need to rest, of course, and sleep. And you need to have supportive nutrition, which means that you need to have cooked food in small portions throughout the day. For example, soups, chicken soup, mama's chicken soup, whatever. Here you have also a white soup that you have in my website that is made of a lot of roots, turnip and white roots and ginger and stuff like that, in order to take out the virus. In addition, you may need some of the things that I mentioned earlier. You can take vitamin C, you can take vitamin D, you can take zinc for sure. All of these may help to take things out as well. If we want to treat the flu, that's a little bit more complicated. And like I said, it's going to take more time. So first of all, you need to reduce the fever, but this time you need gentle sweating, because if we're going to sweat out dramatically, we're going to dry out and the patient is going to be a lot weaker. So you use mint, for example, or you use the kuzo. And the kuzo is a Japanese root that I will show you in a minute what it looks like in the next slide. You have a Chinese herbal formula that is called Bian Plan. Bian is excellent. Mushrooms that you can use, well, Trometis and Coriolis. When you have influenza, you can take it every 3 hours. Within a day or 2, the flu will be out of your system. For sore throat, I would take oregano oil and also the Isatis, but in spray that can go directly into your throat. Again, you need to drink plenty of fluids, but they should be lukewarm or warm in order to not cool the system out and allow the immune system to fight out the virus. You need to rest and sleep. Even if you've got a work to do, well, tough, you've got the flu, you got to rest. Supportive nutrition, cooked little and throughout the day. Usually people don't have appetite, like I said, but there's not much we can do. You still need a little bit of soup, a small bite, just to have something that will give your body things that they can make qi and immune system out of it in order to fight the disease out. Now, when you need to treat the coughs, that's a little bit more tricky. So I put here the 2 main type of coughs. First of all, what we call phlegmy cough, which could be hot or cold. What do I mean by that? There are people who have a lot of phlegm when they cough, but it's very easy to take out, and it's transparent. There's other people who have a lot of phlegm, but it's quite difficult to take out. And when you take it out, it's in the color of, and I'm sorry about the colors, yellow or green. So for them, you need to essentially dry the phlegm. You do it with green tea, you do it with mint, you do it with ginger, you do it with semolina drink. You can do it with daikon. If you know, daikon is the Japanese, it's like turnip, but it's like a Japanese, it looks like a white carrot. Tangerine, so you take the tangerine peel, it's called chenpi, and you dry it. If you go now to China, you will see that in the winter, many houses, they dry the tangerine peel and they put it outside on of the house in order to dry, so that they can use it as tea in order to dry dampness also in the summer. Onion and honey syrup is good. There's an excellent formula called Chinchi Huatantang. You need to avoid phlegm-promoting foods like sugars, wheat, dairy products, citrus fruits, and peanuts. These are all cashew as well. These are all foods that create a lot of phlegm that will exacerbate your cough, and you won't be able to get rid of it for weeks or months or whatever. Acupuncture can help as well. When you're talking about dry cough, you can see here that you need to essentially moisturize the throat, moisturize the lung as well. And the way to do it is by using this, for example, root kuzo. Kuzo is a white root that the Japanese use it for cooking in order to add some moisture into the cooking, like corn flour. You can make a kozo pear syrup. You can buy kozo anywhere around the world. You can make a pear and rosemary or thyme honey syrup. Another type of syrup is onion and honey syrup. You can use licorice root. You can use licorice root and have it as a tea. Pang Dahai is those nuts that you see here. They're called the singer's nut in Chinese medicine. You can find them. And then what you do is you put them in hot water and they open like a flower, a black flower. Not the nicest picture, but believe me, they can help Adele sing. Moisturizing nutrition like soups, stir fry, steam food. You need to have liquids or fluids in your food. You cannot have toast and pretzels and dry food like rice crackers and all of these things, because it will continue to dry you from the inside as well. And of course, acupuncture can help as well. So that was essentially the lecture today, half an hour of your time. I hope you found it useful. I want to give a preview for a course that I will be doing in the future, or how not to die young from the metabolic syndrome. Those of you who don't know what the metabolic syndrome is a combination of diseases that many of us have that make you susceptible, majorly susceptible, for stroke, having a stroke or a heart attack. And these diseases are high levels of sugar, high blood pressure, high level of cholesterol or triglycerides, low levels of good cholesterol, and obesity. Now, at the age of 50, 50% of people suffer from the metabolic syndrome. And the metabolic syndrome, like I said, is one of the leading causes for stroke and heart attack. The whole idea of my course, which I'm now doing, but I will be launching a version in English, is to have 5 weekly meetings. We'll see exactly which day it's going to be. For 1 hour, where I'll be going through the metabolic syndrome and then how to treat high sugar levels, high cholesterol and triglyceride, high blood pressure, and obesity. There will be also a WhatsApp group to support those who will attend the course. It will be recorded and will be available for 2 months after the course has finished. So it will be a wonderful opportunity for any of you. The only thing you need to know is to speak English, because the course is in English. That's about it. But I hope to launch it soon, and on my Instagram and Facebook pages, and hope to see you there too. That's it. I want to thank you. Those of you who've been already on my Facebook and seeing it from Facebook will see that it's Dr. Gil Barzilai Midlife Wellness. That's the Facebook page. You also have the Instagram, which is I am Gil B. And you also have my website, which is DRGIL TCM, Dr. Gil TCM. In the website, you have the site in English and in Hebrew, and you have plenty of articles and also of recipes in English as well. So I encourage you to have a look on my website. It's available for you. And I hope you've enjoyed it. You can share the lecture once it will go up on my Facebook with friends. You can invite them to the Healthier World WhatsApp group that I've created, where once a week I give a tip. It's not up for discussion, meaning I don't open it for people to ask questions and annoy other people with a lot of information. But I do give a tip once a week on Thursdays for Thursday morning with a tip or a recipe. So there's plenty of ways to get health through my website, Facebook, WhatsApp, and Instagram. And I hope to see you next time as well. Thanks a lot. Now let's see if there are questions. And if there are questions, then I will be answering them. If not, then we will call it a day. Let's see. Okay. I'll ask here on the Instagram if there are any questions. And if not, we will call it a day. I'm sending you all my love, and I hope to see you in the future.